This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about, does SI joint pain ever go away? So SI joint, also called the sacroiliac joint, is where your spine connects to your pelvis, and there are these two large joints on either side of your sacrum that connect to your pelvis, and they can often be a source of pain for people. It's kind of pain in your lower back, like really low, but a little bit to the side. And sometimes they go misdiagnosed SI joint pain as people think it's lower back pain, but it's not. So if you're watching this video, maybe you have it or you know someone who has it. So does it ever go away? And the answer is yes, it can go away for most people. How do you do that? The first step is making sure that it actually is SI joint pain, and that is the diagnosis that you have. Your doctor can determine that, or you can just start trying doing the exercises on your own if you think that's what the issue is and you feel fine otherwise. There's certain exercises you can do. It focuses on kind of core and hip abductor strength. Hip abductors are the muscles that do this. And also spinal mobility. And that will kind of stabilize that joint. And when that joint gets stabilized, it doesn't move as much and it shouldn't cause as much inflammation as pain. So that's definitely a good place to start. Another thing you can do if that doesn't help, or in combination with it, is sometimes, and I do this in my practice, you give a steroid injection into the SI joint. And that's like giving an injection into any kind of joint, where it will calm things down and allow you to make more progress with physical therapy and with doing those exercises. If you're motivated, you can do the exercises at home. Some people do benefit from a formal program, which will likely be better than what you're doing at home, but that's kind of a way to go about it. Now, if you're getting a sacroiliac joint injection, make sure that whoever is giving it to you is using imaging. I use ultrasound, but you can also use x-ray. What you don't want is someone sticking a needle blindly in there. There's some joints you can do that with, like the knee or the shoulder, but you cannot do that with the SI joint. It's too narrow of a joint and it's too deep. So if someone's doing that, I would say ask them to use imaging or have somebody else do it. There's other sorts of treatments too that are kind of more controversial. Some people, there's one called prolotherapy, where it's like a steroid injection, but instead of steroid they use sugar water, which sounds weird, and I guess it is, and that's supposed to scar the joint down. That's kind of controversial. I don't think I would start with that. And then rarely people will do something called a sacroiliac joint fusion, where they'll actually fuse the joint together. There's like a dozen different ways to do, different ways to do the surgery, which in the world of surgery means that none of them probably work too great, although some surgeons swear by them. But you could find a spine surgeon who's doing that, and they can talk to you whether they think you would be a good candidate for not. In the right person, I think they could do pretty well. But by and large, most people get better with stretching and plus or minus an injection. And if you do believe you do have sacroiliac joint pain, that would be where I would start. And that, in most cases, will take care of most of your pain. So I hope I was able to answer your questions about does SI joint pain ever go away. If you have any questions I didn't answer, feel free to leave them in the comments below. I'll do my best to respond. But note that I can't respond to your specific medical condition over YouTube. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.